All right, everyone, we're back with our quick bite-sized tips, all designed to help you fuel your strength, nourish your future, and thrive. This week, we're talking drug-induced nutrient depletion, basically nutrients that are depleted at a quicker rate, or we burn through them quicker due to drugs we take. That could be over-the-counter or prescription. I'm not going to go into every single one here, so for a full comprehensive list, just search or Google search drug-induced nutrient depletion. You're going to get a full chart, a full rundown. And, when we think about the things that are constantly prescribed or we're constantly taking over the counter, it can be kind of daunting or scary. And it's important to remember that a lot of the times these things are just band-aids. We'll look at like proton pump inhibitors, for example. Those can really diminish our B12, folic acid, calcium, iron, even protein, according to this chart. So, as we look at it, that's going to be a problem because when we look at, energy production at the mitochondrial level, if we're not getting those nutrients, we're going to be dysfunctional at a cellular level. And then as we expand that out, maybe that's that constant fatigue you feel, inability to rest, you got a high resting heart rate, high blood pressure, all that stuff. And, the good news is, like, you look at what are PPIs typically prescribed for, that's like GERD and stuff. Usually, eating smaller meals, making sure to chew your food, eating higher quality foods, that usually resolves those. So we can't look at like the band-aids, we got to look at getting to the source. So we'll just go through a couple here. So right off the bat, we got estrogen replacement therapy. So Premarin, Estrace, Clemera, that depletes B6 and B12. Magnesium is responsible for over 300 enzymatic reactions in the body, so we need magnesium. Folic acid and zinc, oral contraceptives. So that's basically the whole B series of vitamins, folic acid, magnesium, selenium, zinc, tyrosine. We have beta blockers that depletes coenzyme Q10 and melatonin, two powerful antioxidants. So if we're on beta blockers, we might have increased levels of oxidation in the body. Antibiotics, obviously the intestinal bacteria that we need. All the B vitamins, vitamins K, vitamin C, non-steroidal anti-inflammatory drugs or NSAIDs. Those are typically folic acid, iron, potassium. So again, just to give you a small screenshot into what these things are doing to your body. And then what happens if you're on it? Obviously, if we're on it, the goal should try to be to get off of it. And again, usually lifestyle changes, diet, exercise, things like chewing your food more thoroughly can usually get to the root of the problem. Higher quality foods, all that fun stuff. And then, you may need to get blood work. Getting blood work before taking supplements is a good idea, just to make sure, verify you're depleted. And it's going to be a more thorough blood panel than what your doctor is going to order. So, if we look at like what I order, because I have access to blood labs, I'm going to order a more thorough panel than just a comprehensive metabolic panel because I want to see more things. I want to see deeper. I want to know what targeted supplementation we need. We might even do a urine test just to see how your body is metabolizing things, because that can be a key indicator for us of what's being metabolized what's being spit out in the urine. So that's just some of the ways you could look at what supplements to take. Are some beneficial for everyone? Sure, a good multivitamin, magnesium is probably a good idea. I sometimes even throw creatine in the mix because it's very neuroprotective, good for the brain. So that is just bird's eye view on drug-induced nutrient depletion. I hope you enjoyed this video, and we'll talk soon.